My name is Allison Sanders, student ID number 32666053, and this is my AVMA video for Clinical Pathology 1. Alrighty, so today we're going to go over how to do a fibrinogen assay. What you want to go ahead and do is fill up 2 hematocrit tubes, the same way you would be doing if you're doing a PCV or a total solids. So fill the tube and then put 2 dabs of clay at the bottom. And then in order to do the fibrinogen assay, you have to go ahead and centrifuge these first. So I'm going to go ahead and pop them in the centrifuge and do that. Again, with any centrifuge, we want the centrifuge to be balanced, so put them on opposite sides of each other. And then go ahead and put the top one. And spin this down. And for our centrifuge, we spin the hematocrit tubes on high for 5 minutes, so I will come back once these are done being spun. Alright, so the tubes are done spinning in the centrifuge. So what you want to go ahead and do is get the total solids of just one of the tubes. So I have my refractometer. I'm going to go ahead and get the total solids of it. Look up in the light. So for this one, it's 6.2. So I'm just going to write that number down so I don't forget it. And then with the other hematocrit tube, what you want to go ahead and do is place it in the incubator at 58 degrees Celsius for 3 minutes. So I'm going to go ahead and do that, and then after the 3 minutes are over, I'll come back for the next steps. Alrighty, so after it's done being in the incubator for 3 minutes, we're going to go ahead and take it out. And then we're going to come back over here. And before we get the total solids of this one, we're going to go ahead and centrifuge it again. So again, for our centrifuge, you have to centrifuge it on high for 5 minutes. So I'm going to go ahead and put this back in the centrifuge, and then we'll come back once it's done being centrifuged again. Alrighty, so we're done centrifuging. After being incubated, I'm going to go ahead and get them out. Go ahead and take, this is the one that we placed in the incubator and then centrifuge again. So you go ahead and get the total solids of this. Oh no! Do the same thing. So this one is 7.3. And so the total solids gives us the grams per deciliter, but we want to go ahead and get to the milligrams per deciliter. So what you do is you take the number that you got, the total solid that you got for the non-incubated hematocrit tube, and you multiply that by 1,000, as well as multiplying the total solids that you got for the incubated tube by 1,000. So just to make sure math is correct, I'm going to use a calculator. So 6.2 times 1,000 gives me 6,200, and then the 7.3 times 1,000 gives me 7,300. And for the fibrinogen assay, what you want to go ahead and do is subtract, after you multiply them by 1,000, you want to go ahead and subtract the number that you got for the non-incubated tube minus the number that you got from the incubated tube. So I'm going to go ahead and do that. Which is negative 1,100. So the normal range for fibrinogen assay is anywhere going to be between 1,200 and 3,000. So this is on the lower end of it, which means that there could be it's generally associated with cardiovascular diseases. If it was higher and is on the higher end, so it's reaching past the 3,000, that can be showing factors of any clotting factors or clotting issues within the patient. Alright, so we're going to go over how to do a blood chemistry panel. So right now, the only one that's pending is a one for our SnapPro machine. If we wanted to do like a chemistry, it would pop up over here. You could also put it in manually and go to analyze sample and go to add mutation and just follow the steps and go ahead and plug it all in, and it'll ask for the patient's name, the client ID, it'll ask if it's a feline or canine, and you'll go from there. Unfortunately though, we haven't had anybody that just needed to come in for blood work. So instead of wasting our supplies that we do have, I'm just going to go ahead and run a quality control. So to get to that, you're going to go to instruments, Catalyst 1, because that's going to be the machine that we're working with today. You're going to go to maintenance, and we're doing quality control. Once this pops up, you want to go ahead and match the number that's on the bottle. So you can find it right here. It's the lot number, and you just want to go ahead and make sure you click the right one. So this is R7364. So I will go ahead and do that one, and you're going to run quality control. Since it is the quality control, you do have to go through a bunch of steps and clean the machine itself before we can run it. So I'm going to step away, clean the machine, and get everything set up, and then we'll come back when we're ready to run it. Alrighty, so it's done with its cleaning cycle, so we're going to go ahead and put the sample in. So what you're going to do is open this up. You want to make sure that all the pipette tips are filled, so we're missing one, so we're going to just go and get one from the box and place it there. And then you're going to need a sample cup. This is where you would put the sample from the patient, but again, since we're doing quality control, this is where I'm just going to put the mixture between the control and the dilute. So you're going to go ahead and pop this open. This pipette measures up the perfect amount to put in the sample cup. So just go ahead and pipette it up, and then place it in the sample cup. And then you're going to place the sample cup in here. And then anytime you're doing any test on the Catalyst 1, you always want to put your lights in first. So I have my light packet right here. I'm going to go ahead and slide this on right there. And then since we're doing quality control, I went and got the quality control clip. If we were analyzing an actual patient sample, you would get the chemistry clip, and that'll show its chemistry values. But since we're just doing quality control, I got the quality control clip. And then you go ahead and slide this on. And then you're all set, so you shut it. On here, we'll just hit done, and then you'll press this button. And it'll start doing its magic, and this will pop up on the screen, and it'll tell you once it gets going how long it'll take, and once it's ready, the results will pop up over here. So we'll come back when the results come in. Alrighty, so once it's all done processing the sample, it'll always pop up in the in-house results. So since we did the quality control, it's going to be this. Go ahead and click it and then hit view. It'll pop up with everything that we tested for, and everything is in the normal range, which it should be since we are doing quality control. Everything should be in the normal range. If we were actually doing it with a patient sample that presented for some type of illness or anything, normally there would be some abnormalities. We would have some high stuff, we would have some low stuff, and the abnormalities will kind of help us and direct us in the general direction of diagnosing what's going on and kind of the treatment plans that we would do moving forward. But like I said, since it is just a quality control, everything is in the normal range, which it should be. If there were any abnormalities, if this was a patient sample, we would bring it to the doctor's attention, and we would go from there on how we should treat the patient. Alright, so today we're going to go over how to do a heart rhythm test or an ELISA test. So it comes in a little bag like this. I took this out. We're going to go ahead and do 4 drops of the conjugate into a little spoon. And then here's your 3 drops from the purple top or the EDTA blood. Close it. You want to go ahead and invert it a few times. And then when you do put it in, you're going to go ahead and put it in a little tub of this. But we do have a Snap Pro machine, which kind of does all of the work for us. So the patient's name will pop up here. So there's only one that we're doing right now. So it's right here for Duke. Go ahead and click that, hit the check button, and then it'll tell you to insert it. So then you go ahead, put the sample into the little plug, and then you go ahead and put it in the machine, and it'll click in. And then it'll start processing it, and then when it gets ready to be snapped, the machine will snap it itself and then start a timer for 8 minutes. It'll do all of it. When the 8 minutes is over, it'll snap it back out, and the results will pop up on the screen as well as on the patient's file in the computer, but we'll see that once it's done processing.
Okay.
Alrighty, so after the 8 minutes, the machine will go ahead and spit the heart rhythm test back out, and it shows the results. So if it has this kind of negative sign, that means it was negative. If it did have a positive, it'd have a plus next to it. So you have the control there, and then it also shows where the Ehrlichia Lyme heartworm or anaplasma would be shown if they were positive. But like I said, all these are negative, so there's no other dots there except for the control. So this patient was negative for the heartworm as well as 3 tick-borne diseases, and the results automatically shoot through the computer and pop up on his file, so there's no need to write it down anywhere. It's already saved in his file, and it also will pop up here in in-house results. You can go here and hit view, and it'll also say negative as well. I'm going to go over how to do a heartworm direct smear. So what you need is you're going to go ahead and take your purple top, which has the EDTA blood in it, and you also need your slide, as well as a pipette and a cover slip. So what you want to go ahead and do is just go ahead and place 1 drop of blood on the slide. One spat's on there. You want to go ahead and place a cover slip over top of it. By doing that, it should separate evenly across the cover slip, and then this is what you go ahead and look under the microscope with. Alrighty, so I'm all set to look under the microscope for my heartworm direct smear. With this, you're going to go ahead and start with the 10x just to get it focused in. Once you do that, you can go ahead and move to the 40x, which is where we'll actually be looking for it. Within this motion, you want to do a back to forth and up and down motion when scanning the side. And you're looking for any type of movement. If there are microfilaria, they'll kind of be swimming around in the red blood cells. And you can also watch out for the red blood cells, because if there are any microfilaria present in the blood, then the red blood cells will kind of be wiggling around next to them. So I'm going to go ahead and just get this focused on the 10x. Once you have that focus, I'm going to go ahead and move to the 40x, which is our high dry. And this is where I'm going to start scanning. Again, focus first. And then I'm going to go in that back and forth and up and down motion. Again, while I'm scanning, just going to be looking for any type of movement. If I see any wiggling of the red blood cells or anything like that, I will go ahead and make notes for that. But so far, I'm not seeing anything. Alright, so after scanning the whole entire slide, I did not see any movement, any swimming, or anything like that, so I can conclude, at least from the direct smear, that there are no heartworms present within this patient. Unfortunately, though, this isn't the most conventional way to determine whether or not there are heartworms, and it's not the most conclusive, because there is something called a subcutaneous filarial worm that is unable, you can't differentiate the two just looking on a direct smear. So unfortunately, direct smears aren't the most conclusive in determining whether or not a patient has heartworms, but it is one of the ways to determine if they do. And for this particular patient, I'm going to conclude that he doesn't have any heartworms, at least from the direct smear that I did. I didn't see any movement or anything like that, but if I wanted a more accurate thing, I would go ahead and run other tests just to make sure.